We all need to get the vaccine so we can get back to our lives. I'm getting the vaccine for my family, my friends, my patients, my coworkers, and my community because I'm an Eastern North Carolina girl and I love my community.
Well, hello there, and welcome to the Well After Hours. I'm your host, Beverly Allen. So glad to have you join us again. And today is going to be very informative. I'm so happy to invite my special guest today in the person of Dr. Claudia Weaver Richardson. Dr. Richardson, thank you so much for taking time to be with us today.
Absolutely, my pleasure and honor.
We've been so inundated with all kinds of information about, the COVID-19 and the vaccine and, the different type of vaccines, what's coming out. And I just was going to ask you if you could put something, shed a little light on some of this for us in perspective. But before we do that, would you please tell the viewers about you because you have such a long resume, y'all. We could take the show just talking about her bio today, but I'm going to ask her to give just a little brief information so the viewers know who we're privileged to have on the show today.
Sure. Um, I'm again Claudia Weaver Richardson. Are you hearing any feedback?
No, I'm
No,
hearing you. No, no.
just fine. Okay, great. I am from Hosky, North Carolina, which is a small town in northeastern North Carolina, about an hour south of Norfolk, Virginia. And I was born and bred, as we say in the country, and I actually uh, God would have it so that I'd end up right back here, happily so. I'm an OBGYN in training, but I also have my master's in public health. Um, I went to school in North Carolina, Duke, and then East Carolina, and I did my residency training at Wayne State in Detroit, Michigan. So from there, I decided to come back home. I surprised myself. I said I would never come back to a small town to live, but I've been there ever since. I had my own OBGYN practice for many years. And then I went to work and some other, closed down my office and went to work with some others. And then shifted toward that public health piece of my education and administration. And that's where I met our mutual friend,
Yes,
Hilda Whitaker, and in Rocky Mount there. And I served as CMO at OIC Family Medical Center there in Rocky Mount. And then a couple of years in Baltimore with Planned Parenthood, and then back here in Ahoskie, North Carolina as Chief Medical Officer.
that's so awesome. No, wow. Well, you certainly have great credentials, and I thank you for sharing, your expertise with us today. But you know what? Speaking about the vaccines, we just heard on the news the other day about the supply they thought they had in reserve, and it seems to not be there. And not though in many of our communities, people weren't rushing to try to get the vaccine
Mm-hmm.
from past history. We're holding back a little bit until
Sure.
things things. But you know, can you just tell us a little bit about the vaccines because there's so much misinformation that's going out as well because you're online and you're hearing this and you're hearing that, this one over that, and if this is not stored properly, what you can make some sense of it for us, really.
Sure. First of all, I just want to address, the vaccine, what we call vaccine hesitancy. Yeah, it's real. There are lots of reasons why, valid reasons why people are concerned about taking the vaccine, especially in um, the brown and black communities because of history. Everybody's heard about the Tuskegee experiment and then sterilization, actually, right here in North Carolina, um, and many others where our rights, we didn't give full consent to research. And I also want to take this moment to say that research in the American community, or communities of color, is important also. So I want to say, we just want people to consent to participation, because it's important for us to be involved, be part of the solution, and to have the information that's needed when drugs or things come out on the market. We just want um, to be given the opportunity for proper consent.
Yeah.
so, so having said that, and then there were many who did sign up to participate in the trials, and we are grateful to
Mhm.
those people of color who chose to do that.
Wow.
Now, of course, right now there are two vaccines that are available under emergency use authorization. And those are the Pfizer vaccine, which came out first, and then the Moderna vaccine. First of all, emergency use authorization is sort of a shortened period um, for uh, for the FDA clearance, if you will, because obviously our dire situation that we're in.
Mm.
However, it may be a little fearful, especially for older folks who remember how long it took to develop vaccines. But what we need to understand about these two vaccines is that the technology for it all was going on in the background, and much of it had been done when the SARS outbreak a few years ago. Do you remember that
Yes.
sort of flu-like illness came on? So that we learned a lot, and we, as in the world, learned a lot about um, this kind of virus during that period of time. So that, and then this newer technology of messenger RNA, which is what people might be hearing, is why the vaccine was able to get out quicker than other vaccines in the past. The other reason it was able to get out quicker was because um, for the first time in my career, I seen scientists working together in the same workspace. Usually companies compete for
Yes.
to get something, but
Mhm.
people were sharing science on to get they were working together to solve this problem. And that is the other reason why the vaccines were able to come out so quickly. With that in the background and that knowledge, we'll talk a little bit more specifically about the two vaccines. So the Pfizer vaccine, again, the first one, is they use the same sort of technology with what they call the messenger RNA. And basically, the messenger RNA sort of uh, is in the vaccine, goes into your cells and sort of creates a message for your cells to produce um, uh, the ability, or to gain the ability to fight off the virus. And then that messenger goes away. It's another way of thinking of it is that it dissolves. So that what's in the vaccine goes away. What is left is your own body's immune response that it got started up, if you will.
Mhm.
Um, does that does that make sense?
It
I'm trying to
does.
make
It kind of it delivers the message and then goes.
exactly.
Yeah, it hits and leaves a message there. Wow.
Right. So it's not a live virus. So I want to be real clear about that. You don't get the coronavirus from the vaccine. You cannot.
Oh, thank you for clearing that up because that was my big question. How are they going to, inject this virus in you when there's no immune system, cure
Right.
within you, Yeah.
So the way older vaccines worked actually was they gave you just a little bit so your body could develop an immune response. this is not live virus at all. It's sort of tricking your cells into thinking that the virus is there, developing the immune response to the virus, and then it kind of goes away, the what was in the vaccine. The tech, it's fascinating technology,
It
but you can, so therefore we've not given any virus in the vaccine, so you can't get the virus from the vaccine. The Pfizer vaccine has to be stored at very low temperatures. That's what we've heard a lot about. Um, that is why the Pfizer vaccine has gone to many hospitals starting out, because they had the tech, the
capable,
freezers,
yeah.
and or yeah, so they could invest in those kinds of freezers and vaccinate employees starting out, so
Yes.
that they could take care of the
Yes.
COVID patients. Um, and That's been primarily the goal of the Pfizer vaccine. The Moderna vaccine, which is more commonly seen going through, say, health departments, um, mass testing, mass vaccination events. But I'm not sure, there may be in some large cities some Pfizer vaccine there too, because they have the capacity to get it from a very cold storage place to the vaccination place very quickly. And when I say mass, I think I mentioned to you earlier, New Jersey's doing some great things, and now you're hearing what California's doing, using football stadiums and all of that kind of
Mhm.
thing. So with that close proximity, it could be one or the other. The biggest message is that there is a strict what they call cold chain process, where the vaccine temp has to be measured from place to place. So, and if it's something that goes wrong with that, they have to get rid of it. And then I haven't heard any stories of any major instances of that, but we want the public to know that those processes are in place to make sure that it stays at the temperature that it's supposed to stay at until it's time for vaccination. If you get one shot, say, of the Pfizer, you should get the second Pfizer uh, shot or vaccine. So no mixing of the vaccines. You can't get one kind and then get the other
Other-
kind because it's available. No mixing. Um, and that one is 21 days apart, around 20, at least 21 days apart. The other one is Moderna, which does not have to be at at the higher temperatures, which makes it easier for
Easier to.
people in the community to get that kind of vaccine,
Mhm.
whether it's going through the health department or I don't know. We hope down the road even mobile units and whatever way we can get it into the community. Of course, one thing that I'm concerned about, and many others, are being able to penetrate our communities, our Black and Brown communities, with the vaccine when it's widely available. Right now, there's a rollout. You've heard about the rollout, healthcare workers first,
First, yeah.
then
First responders and all, yeah.
right. And now it was 75 and up. Now it's 65 and up. And what there were it was, things were a little more complicated. You had to be this class, that class, and folks, the government, the state started realizing that we were making it a bit complicated. And what we want to do is get vaccine in arms, as we say. We want
Yeah.
people to get vaccinated so we can stop this hot mess that we're in right now. I mean, I'm in a county in northeastern North Carolina, like I said, rural. Right now, our a county next to us, which is even more rural, has the highest positivity rate in the state. and our county is number 2 in the state. And my organization that I work for, we have been on top of this from day one. We were on it. We were, we were ahead of the game, even
Wow.
in the work that larger cities were doing. But here we are. Here we
Wow.
are right now. And we all know a lot of that has to do with some of the holiday gathering. We know that that's part of that, but we also know that people are tired. They are suffering from being alone.
Yeah.
It's causing such suffering. So um, that's sort of where we are right now. So Moderna is the other difference between the Moderna and the Pfizer is that the Moderna vaccine is you get your second dose in 4 weeks and 28 days or more. Now, people who have had coronavirus should still get the vaccine.
Hmm.
Um, could you get corona? Could you be corona positive? And because we're not testing people, if
Yeah.
they're asymptomatic, we're not doing a test. We're giving you a shot. That's what we're doing.
Hmm.
Now, could you have gotten COVID 3 days before that? Yep.
Hmm.
You could
Wow.
have. Could you have a positive test a week later? Yes. If you got COVID, you could. So I want to be really clear. The vaccine didn't give a person COVID. They were exposed or something happened before that.
I'm
So
glad you pointed that out because even when we used to get the flu shot, people used to think when they got the flu, the shot, that, wait, I still got the flu, that, but you might have had a cold before then. It wasn't the shot that gave you the flu.
right.
You
Yeah,
know?
and it can so it can give you the flu shot, for example, can give you sort of mild flu symptoms. That's kind of a sign for a day, but it should be really short.
Hmm.
And that's kind of a good sign that your
Yeah.
body is developing an immune response.
Hmm.
And you can still get the flu even if you've had the flu shot.
Shot.
What it does is reduce the severity of it, and that's the goal. People die from the flu every year, and so we
That's
don't
true.
want that to happen. Now about the these vaccines, though, following getting the second COVID vaccine shot,
Hmm.
um, the many patients, it is completely normal for patients to have high fever, muscle aches, headache, all of that. It's normal. So I'm so glad you're giving me this space to say that. That
Yes.
is common
Okay.
for people to have. So if you can take the next day off from work, I would advise that if it's possible. That is very common. That doesn't mean there's anything wrong.
Hmm.
That is totally, totally a very common side effects. It's not, yeah, of the vaccine, of just taking the vaccine. Sore arm. Everyone I've talked to lasts a day. They're good by the next day.
Hmm. Hmm.
So just want to warn people about that, and just be prepared to rest and drink fluids and take it easy that next day.
Wow.
Totally expected.
Hmm. Well, the thinking about the rollout plan, by the time it gets to the general public, they say Johnson and Johnson is coming out with something. That's another story. But
Well, we don't know. So
yeah.
that's a good thing. There was all of these companies started early on to get it going. And we still want them to produce a vaccine because we have to vaccinate the whole world.
Yeah.
So Johnson and Johnson may come out with something, the Oxford one,
Yeah.
AstraZeneca, I'm sure they'll have a vaccine out shortly. The data has to be reviewed, just like it was here, and that process, the FDA followed that process along with the CDC. So independent scientists could look at it, not just governmental scientists, but the science community has tried to help us so much in all of this, as much as the independent science community that has tried to help us so much. So we can be reassured that due diligence was done to get there were no um,
Real shortcuts and things like,
yeah, and
yeah,
no,
side
yeah,
stuff.
and right, and the scientific committees that reviewed it were not appointed by anybody, or they weren't had interest in any company or anything like
Mhm.
that. I want to say that.
No, independent. Wow. Well, that is really great to know. I guess the real question is it being produced fast enough? Because, you know, if you don't get that, if I get the first shot and they run out of the supply, and that's past my daytime of getting it, 21 or 28 days, whatever, to get the second shot, I have to start all over again, I would imagine. Or,
Well, actually, you don't,
oh,
and you don't have to start over. That is a great point, and a source of my frustration right now and many others is the rollout. None of I was just listening to Governor Cuomo expressing his frustration, but really it's every state. None of the states got what they were supposed to get in the allotment, and we don't know what the problem is. Drug companies are saying it's not production. They're saying it's not production. Um, so what is it? I
politics or what?
I don't know.
Isn't that something?
Yeah,
So they have enough.
what is it? So I'm excited to hear, and I've read a little bit of the Biden plan. I know that he his administration has taken on the philosophy of let's just use and put the companies to test, like, no, you need to produce, and they are saying that they can. So what the original process was, if you got a vaccine, they held a vaccine for you for the second one, and that has been the process so far. So that's why some vaccines are sitting around, because they're waiting to give that other injection.
Hmm.
And because of, quite frankly, well, that was the original intent, but also an additional fear is that there is no predictability about how much a state is going to get from week to week. It's really fascinating and frustrating. And then how much a county. So our county got something like 800 one week and 200 the next week or something like that. It's no rhyme or reason to the distribution. But hopefully our new administration, with having assembled a team and outlined a plan already, will help move that along.
Yeah, and with the change, like you said, in administration, there'll be more people, more oversight on that because, there was a lot lost with this,
Right. And
administration.
involving the military, I mean, I do know in the Biden plan, and I had heard this before, but no one ever really talked about it. But, we want all hands on deck. I mean, that was what was said from the beginning when COVID really started, um, showing who it was.
Mm-hmm.
They were, our state at least was offering, doctors who had retired, nurses who had retired, licensure, temporary licensure to help with
Mhm.
with the pandemic. And the Biden plan is, talking about those same things, including like whoever can give a vaccine safely.
That's they
Whoever,
said veterinarians, you name
exactly,
it. Anybody.
exactly, exactly.
Everybody, yeah. When
Stop
they said,
in arms.
yeah.
Yeah, because our hospitals, we tried so hard. I work in the outpatient setting, and I saw very much our responsibility to try to keep people out of the hospital. We set up a clinic where we took respiratory care. We sent a lot of people home for virtual work. Um, we, have done testing outside. We've seen patients outside. We did all of that trying to keep, and we implemented a robust case management program where we call patients once or twice a day. We wanted them to stay away from the hospital unless they absolutely had to go. Now our hospitals are overwhelmed across the country. Even in my town, we've had people have to stay in the EDs functioning as a mini ICU because of beds, shortages, and not just here. So they're short all around us.
Wow.
So I never thought I would see that. We worked so hard to keep that from happening. But
Mm.
this last holiday season it just took us over. It really
And,
did.
and yet it seems like people still don't get the message of social distancing and wearing a mask.
Yeah, I remained baffled by that, and I'm sorry for my colleagues and my coworkers and family members who have suffered as a result of that. Especially you see nurses and doctors losing their lives in hospital settings, and you see
EMT
surges
workers, oh my goodness.
when people could have made a different choice.
I wanted to ask too is what is the difference between when some people get COVID and they can go home and quarantine and those that get it more severely or affected more severely and have to go in the hospital on a respirator? Like when Governor Cuomo's brother, who's at CNN, he got COVID, but he was at home. And I mean, what is there some kind of special treatment that you can, take or, you know, I'm just, kind of confused about that.
Sure. Well, the biggest difference really is risk factors, health risk factors that a person has who might get COVID. For example, obesity is a huge risk factor for how well someone will do when they get COVID. Diabetes is another one. People who have diabetes have a higher chance for severe disease. So the way we sort of look at that is, risk for mild disease or risk for moderate to severe disease. And so, unfortunately, in our communities of Black and Brown communities, we're already behind in, our health as far as diabetes, hypertension. It's just we don't do as well as some other communities as far as getting those diseases, and even when both communities have it, we do worse. So that is the risk factors, asthma, um, hypertension, a little bit. They've gone back and forth with that. Um, Chronic kidney disease, very bad. It's a very bad one. People who are on dialysis are at very high risk. So that would be one of the biggest reasons for the difference. Now, you are going to hear, I have heard of cases, people totally fine um, and have a bad outcome. We don't have a reason to explain that. We don't know. And it has been just incredibly challenging, fascinating at the same time, but challenging to treat a disease that you don't know about. I mean, I'm having flashbacks now to a year ago. We thought we just got a little it was a respiratory disease that was highly contagious, and people who did okay uh, with the respiratory part or didn't have, too much of a cough or anything, they would be fine. But then we started discovering, the blood, how it affects blood clots. It causes blood clots and damages the intestines and the heart. It can damage the heart muscle itself. Even some young kids are having that. They did a study with athletes and did, took x-rays or MRIs of their hearts who had COVID and were fine. They recovered, but they saw changes, in their hearts. So we still right now do not know what the long-term effects of COVID are going to be on people who had even mild disease. And that's the once we get the vaccine and get this pandemic under control, that's going to be the next thing that we have to start paying more attention to.
And when the COVID, once it gets in, it never
Mm.
gets out. Is that it? That's what I've been
No,
trying to.
no, no. So think of it like this is not a great analogy, but if you light, well, if something causes damage, like if you have a car accident, I guess this is a good way to look at it. It won't be too scary. If you have a car accident and you bump your car might have some damage, but it's drivable and everything. It still does everything car's supposed to do. But it's just that little area there that is damaged from recovery. Really, the recovery process is part of it. Um, and actually that, I mean, there are lots of diseases um, that can cause scarring, like infection that causes scarring. That's not an uncommon thing
Mhm.
where an infection can cause scarring. What is overwhelming, like say somebody had appendicitis and they didn't know it and it ruptured,
Mhm.
they'll have scar tissue inside their abdomen or whatever, but the surgeon will take the appendix out and they'll be fine. It just the scar tissue will be there. So anytime there's an infection, there's always a risk of scarring, especially if that infection is there for a long period of time. What is just so fascinating and unbelievable about this, we thought it just affected a respiratory system, but it affects all of these other systems. And it can, the scarring process can be there. We just don't, we're just learning more
As you
about it.
go, yeah. So I was wondering, like, if you have COVID, but you're not having respiratory issues where you really need to, you know, uh, be put on oxygen or something like that. Which brings me to another question. Is it true that a virus can't exist in the presence of oxygen?
No, that's not true.
Oh, okay.
Not true at all.
Okay.
No, 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 no.
There
um
goes all that stuff they put on the internet. See what I mean?
Yeah, yeah, yeah. I mean, I think I don't know if that's trying to reference the fact that a virus, to really do its work, it has to be in a host. It has to be in a
Something to carry
body
it.
that has
Yeah.
cells and replication going on and all of that. Um, but oxygen is merely trying to treat the
The
low oxygen levels
levels.
that
Okay.
are in. Now, also would like to point out one of the challenging and interesting things about COVID. as it relates to low oxygen levels, which we had to learn. This was on the job training. Most respiratory diseases, when people get short of breath, they'll get short of breath, and then there might be wheezing or something, but they'll have some symptoms. What we noticed with COVID is this phenomenon called silent hypoxia or silent low oxygen. And patients could be saying, I feel fine. And would check their oxygen and it would be low, like scary low. And that has been one of the most challenging management problems in with this, because patients early on were crashing at home because they felt fine and then they didn't, and then by the time they got to the hospital, there was nothing anybody could do. And
Wow.
so that's why, pulse oximeters are selling on Amazon, and
Hmm.
we have our case managers, for our higher risk patients with some of those risk factors that I talked to you about,
Yes.
or anybody who has shortness of breath. We used to automatically send them to the hospital. Well, we don't do that now, as because there's nowhere for them to
To
go.
go.
We're monitoring their oxygen levels, and if their oxygen levels are fine, we will continue to see how they do at home. But if their oxygen levels are not fine, they do need to go to the hospital, and you really do need a pulse ox to determine that. And that is so unusual from any other respiratory disease that we've seen. Um,
Wow. That's amazing. It's almost like they're little soldiers who have been programmed to go in there and destroy,
yeah,
it's amazing. And that's why people were wondering, I think early on, like if this was kind of something like they would have used in chemical warfare or something that got unleashed. Remember, they were talking about how over in China they were studying all these things, and we were thinking, like, wow, if the body can't fight it, then it must be man-made, because they were.
well, but we don't have far to look. Like this pandemic. There was a pandemic predicted to come around this time. Pandemics come every so
Many
many
years.
years, and the federal government actually was doing so much work during the Obama administration. They had play-by-play book. They had a team that was, working on that. They even had a mini practice, if you will,
Yeah.
during the Trump administration from that team from the Obama administration, and they identified, weaknesses in it. As evolution, we're always evolving, if you will, and so are bugs and viruses and all of that. So, I mean, this will there will continue to
Yeah.
be new kinds of viruses. And this is why this is a great opportunity for us to look at doing the things to get healthier,
Mm.
especially as it involves our immune system.
System. Yeah.
So, cutting down on carbohydrates, taking, vitamins, multivitamins, but including zinc and vitamin C and vitamin D. Vitamin D levels are commonly low,
Yes.
communities of color, but also exercise. This whole concept of inflammation in general
Mm.
has come a long way in medicine and trying to do things to cut inflammation down. We know inflammation is what's causing heart attacks. We know inflammation is what's causing arthritis. Inflammation is causing lots of diseases in our body now, and we need to do everything we can to cut down that inflammation by fighting, building up our immune
It's-
system and fighting against that inflammation with good food foods with antioxidants. And so here's the time. That's what we need to do. Now, while we're trying to take care of ourselves
Yeah.
during the pandemic, whether you've had the COVID virus or not, we need to, work on that while we can, because they will continue to come. They will.
And they say the strongest thing that you can do is to build up your immune system. The strongest immune system is the best defense, and so uh, that's great. And for people who, my last question is for people who have the mild case and are sent home, what is the regimen that the hospital usually prescribes for them to do? Or,
Sure. Yeah, really just kind of like you would with the flu. Rest, fluids, um, treating the symptoms. So
yeah.
some patients will have headache, take ibuprofen or Tylenol for that. Body aches, you can take that. If you're having GI upset, Pepto-Bismol. So rest, fluids, and treating those symptoms.
Oh,
Those are the biggest thing. And stay in contact with your healthcare provider. If if you're not getting better, or if you're feeling, this is the other thing I want to really point out. Increasing fatigue is a sign of worsening disease. So even if you're not short of breath and you start just noticing that you can't go, I've heard people say, from the chair to the couch and the couch to the chair. If it's getting worse, your oxygen really needs to be checked, and you need to check in with your provider.
wow. Okay. It makes me think, because like people who have, say, like sleep apnea, and that's one of those things that if you have sleep apnea and you're already on a machine, like they sleep with that machine at night or
Mhm.
whatever, is that helpful?
No one's looked at that, but I in my mind, it's, if you're supposed to be on a sleep apnea machine, you need to use it.
Yeah, right, yeah.
Because what I find with my friends and patients is that lots of times they don't want to use
It's good if you use it, right? It's only good if you use it.
right.
Yeah. Oh, wow. Well, I tell you that you have just provided us with such information, and I think peace of mind, and reassurance, like hearing you, detail some of the things that you have put out there. I so appreciate you taking the time, and I'm sure the viewers do as well. And I'll have to report in with you from time to time. I'm so glad for this first time. As I tell people, it may be your first time, but not your last time to
Well,
check in as things progress.
yeah, thank you so much for this forum. And I will say, our office got our first vaccine a week ago, last Friday, and you could just feel the relief. People were giddy, almost. Felt a sense that hope was coming, hope was here, actually. And I really wanted to share that with your viewers.
That is so great. And that, to have hope. And while we have hope in the vaccine, as you being a woman of faith too, which is something that's like our hope is built on nothing less.
Nothing less. Nothing less.
Yes. And so hope in him that he will provide. And having said that, I just want to give you some last words. Is there anything you'd like to say to the viewers? Anything encouraging or anything out? And then after that, I'm going to ask you to close us out with a prayer. So to include in with your closing remarks, you were encouraging, let you state that you was encouraging the communities, the Black and brown communities, to try to get on the list. I'll let you say that, because it'll mean more coming from you.
Sure. Of course, it varies from state to state, how community folks are getting the vaccine. In North Carolina, for example, uh, it was age 75, now it's age 65 or older are eligible. And the reason why that's been simplified a little bit is because we want to get vaccines to people with fewer obstacles, if you will. Right now, the challenge has been states, I think I mentioned this earlier, getting enough vaccines. However, there are still processes in place to get on the list, if you will. In North Carolina, all patients 65 and over are advised to call the health department. Now, later on, their own private doctors will get it too. Um, I work for a community health center, so we're kind of between the health department and the private doctor's office getting it. Um, and we don't know when we'll get it, but we have developed lists of our patients who are 65 and older and looking for ways to ask them if they want the vaccine. But right now, the only option in North Carolina, right this second, that could change next week. But
Mm,
right this second is for patients 65 and over to register with the health department. So I would strongly encourage you to investigate what is going on in your community. It is going to be a long time. I hope I eat these words, but it will likely be a long time before your private physician gets a vaccine. More of the shift now is larger spaces and management with health departments and now community health centers. But regardless, try to get your name on a list. Somebody, preferably starting with the health department if that's the way it's being done in New Jersey. The biggest thing is to investigate how things are being done in your area. We would prefer for people not to be in line for 5 hours or
yeah.
6 hours, to have some kind of scheduled way to get things done, unless if the efficiency in the process improves. And I also think in the next few weeks at these big events, efficiency will improve such that you might not need to be scheduled. But right now, if there's an opportunity for you to get on a schedule, I recommend that you do that.
Great, great, great. Thank you so much for stating that, for giving that inclusion, so that will encourage more people to, to not be afraid, don't be fearful, to go get the vaccine
Mhm.
and get on the list. So, again, thank you so much,
Oh,
Dr.
thank
Richardson, for making.
just hang in there. I have to say to myself, God is in control. I've had to say that so many times this year. God is in control, and what He has promised us, and the thing that is most reassurance is His presence.
Yes.
He has been here all along, and He will continue to be here with us.
Thank God. Thank you, Lord. That is reassuring.
Yes, we
Blessed
have to
assurance.
remind ourselves sometimes, but
Yes. I know, and thank you for your service, all that you're doing, because you're in the front line. You're with the patients. You're right in the trenches. And, I'm praying for you. I will continue to pray for you that the Lord will keep you covered and keep his hand of mercy on you and your family, that is, even as you provide, that God will provide for you. So I thank God for that. Now I'll let you close us out with prayer. Thank you.
dear Lord, we just thank you for this opportunity to gather, even in this form of virtual Zoom, Lord. We know that you know us better than we know ourselves. You know
Yes,
what we're
Lord.
going through. You know our pains. You
Yes,
know our mourning. You know our even our joy. God,
yes, Lord.
we just are thankful that you have created, first of all, these venues to help us with isolation during this period of time.
Yes, Lord.
Lord, we're praying safety for all who are under my voice right now, especially today and in this coming week. Lord, thank you for reminding us in all the spaces that we see you that you are right there. You are
Yes,
right here with us. Lord, please bless the health,
yes,
the physical health, the mental health, the spiritual health of all who are here.
yes.
These, thank you so much for Evangelist Beverly. Thank you for the work that she is doing. These and all things we ask in your precious name. Amen.
Amen. Thank you so much again. And I appreciate you so much. And I have to give my girlfriend a call and tell her, boy, she really hit it out the park by making that connection. I appreciate it. And I pray God's blessings on you, viewers. I hope that you're encouraged and that you're even a little bit more informed after this. And we look for you every Thursday, 7:30 p.m. on Facebook, Beverly D. Allen, and on YouTube channel, Beverly D. Allen Ministries. God bless you. We're praying for you all. And let's keep our hope and our faith up because we still have the one that's sitting on the throne. So God bless you. And we look for you next time on the Well After Hours. Bye-bye.
Hi, I'm Dr. Claudia Weaver Richardson, Chief Medical Officer at Roanoke Chowan Community Health Center. Just as it's important to socially distance and limit your risk of exposure to COVID-19, it's equally as important not to delay care if you're sick or have a chronic illness in order to avoid serious complications that can arise when untreated. Continue to see your provider for regular screenings, vaccinations, and follow-up visits. And give us a call if you're not feeling well, especially if you have symptoms of COVID-19 such as fever, cough, shortness of breath, new loss of taste or smell, or flu-like symptoms. You can trust RCCHC to make your health a top priority. We've enhanced our already robust cleaning and disinfecting measures to reduce the spread of infection, to ensure we're providing the safest possible environment while we care for you. Whether that's through a video visit, curbside visit, or in person at one of our clinics or pharmacies. In fact, you can always see a provider in person if you're sick. A lot has changed over the last few months, but what hasn't changed is RCCHC's commitment to providing the best quality care for our patients. We're here to keep you healthy and to keep you safe.